Hi, I'm Jane Graupman. I'm the Executive Director of the International Institute of Minnesota. We're located in St. Paul, Minnesota, and we work with new Americans in our community. So we have an agency that really provides comprehensive services to new Americans in our community. So today I'm going to talk to you about our career pathway work. We have two pathways at the Institute. We have a medical careers pathway and a hospitality careers pathway. The hospitality careers pathway is quite new, just started 2 years ago, but our medical careers pathway has been in existence. So it started 26 years ago with our nursing assistant program. So I'm going to jump in and talk to you a little bit about how and why the pathway evolved, why we started this pathway, and what's happened over the 26 years of its evolution. It seems like a minute, not 26 years. So it started with a nursing assistant training program, which I know now seems like old news because a lot of people have them. But 26 years ago, we were sending new Americans who had, some of them been medical doctors in their country, some of them nurses, and had careers, and some of them were just interested in the healthcare pathway and did not have that experience in their country. So it was a variety of folks that were interested in this work. So we would send them 26 years ago, to our community college, several of them in our community, and they would come back and tell us they were unable to pass the course because at that time the course was 2.5 days long, and it was about a 14-unit curriculum. So we decided to start our own nursing assistant training program so that we could include integrated instruction, which now all of us are doing that work, but it was very new at that time. And the way we did our integrated instruction was we would have an ESL instructor come in and talk about the vocabulary that would be in Unit 1, and then the concepts to get students ready. And then the nurse would come in then and deliver the technical parts of the curriculum. So in other words, the ESL teacher laid the groundwork for the nurse so that when she was talking about a syringe or she was talking about a thermometer, students were lost on what is that, how does it work, what are the parts of it, and what are the verbs and nouns that go with that. So that was really key, and it's a model that's worked really beautifully. So we have 3 nurses on staff. We have 2 ESL instructors with the program, and we train 145 people a year. So that's been just a very successful program, and that's where we started. And to date, we've employed 1,900, just over 1,900 nursing assistants in area long-term care facilities in our community. So the program's really been a great success. Half of the people that enter that program, that part of the pathway, are unemployed. And so it's a huge wage increase for them. And after 1 year of working in the program, they're making almost $24,000 a year. And they're making $13 and about 70 cents an hour. So, and then after 2 years, most of them are working full time. So really, if you're one person, can really help to get you out of poverty. So, and then we recently added a pre-nursing assistant class for folks that were unable to make it into the nursing assistant course. We have our own tests that we designed. We don't use a standardized test, which is super helpful. We designed our own. We know what it takes to be successful. The test really works well. And then for those people that couldn't pass the test, of which we've had quite a few over the years, we now started a pre-nursing assistant. So it's English, working on reading and writing and oral production too, but really in the context of some of the curriculum from the nursing assistant program. And that's worked very well. It's really been successful. So then after folks have worked as nursing assistants, they can come back to the Institute and take our college readiness course. And our college readiness course is really intensive reading, writing, and math that prepares people for college, so that when they go to take their test, their Accuplacer test to get into college, they can get a high enough score so that they bypass developmental education. This has really been a huge success and super important for our students because it saves them a lot of time and a lot of money. And then once they get into an LPN and RN program, they're much more successful if they haven't been delayed in their education at the college. So the college readiness class was developed, and then after that, we developed our medical career advancement piece of the pathway. And that is a full-time case manager who helps people do what we call educational case management. So helping them access programs at the college, we're helping them work through systems at the college, financial aid, helping them access scholarships that exist at the college through the foundations, also helping them access employer scholarships, doing career inventories in healthcare with them. If they don't want to be a nurse, what else could they be? And also helping them with making sure that their lives are in order and there's childcare for their kids and transportation, thinking through all those things that can be barriers before that they get into college, so that once they get there, they can be focused on their work. And so Brooke Ashland is that person here, and she just helps people with all sorts of really anything that they need. And she also matches them with tutors if they need help with writing. We have several nurses that are retired that help our students prepare for their nursing exam when they finish their courses. So, and then we also have a very strong partnership with St. Paul College. And that college, we teach 3 or 4 classes on site at the college to help students be successful in their anatomy and physiology course. We do bridge programming there for that course also. And we've helped about 470 folks become LPNs and RNs and other positions, phlebotomist positions in healthcare. And so the pathway's really taken time to develop, but it really has helped a lot of people move out of poverty and into really durable wage employment in healthcare. I hope that's helpful. Thank you.